On this edition of Veterans Health Watch, we'll provide an update on the programs available to veterans through the VA. And we'll look into how the VA is connecting with veterans to get their feedback on the services and care they receive. And we'll explore how the collaboration between the VA Maryland healthcare system and the VA Baltimore Regional Office enhances the services provided to Maryland's veterans. Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin. As many of you know, we welcome feedback from our veterans on topics they like to see on our show. Recently, some veterans expressed surprise at the multitude of services available through the VA. So today we're dedicating our show to provide updates and new information about services available not just through the VA Maryland healthcare system, but also through the Veterans Benefits Administration. Joining us is Dr. Adam Robinson, the Director of the VA Maryland healthcare system, and Dr. Sandra Marshall, the Acting Chief of Staff for the VA Maryland healthcare system. Thank you both for joining us.
Thank you very much, Kenya.
Good morning.
Good morning. Dr. Robinson, the last time you were on our cable show, you just joined the VA as the Chief of Staff, and you've recently been named the Director of the VA Maryland healthcare system, so congratulations.
Thank you very much. I appreciate that.
It's interesting to note for our viewing audience that you are the first veteran Director of the VA Maryland healthcare system. So can you tell us how you plan to apply your experience as a physician, a 35-year U.S. Navy veteran, and a former Surgeon General of the U.S. Navy to your role as a director?
I feel that my role as a veteran and also as the director is a continuation of federal medicine service and service to the nation's veterans. I feel like this is a continuation of my active duty service. And I'm really honored to be here because as I retired from the Navy, and as I looked at what I would do in the next phase of my life, there's nothing that I enjoy better, and there's nothing that I like better than to continue to serve the veterans of America who need our help, and it's really an honor to be here and do that.
Dr. Robinson, can you explain for our viewing audience your concept of care for the VA Maryland healthcare system, patient and family-centered care?
The essence of medicine is to make sure that we care for our patients. In the VA system, our patients are also veterans, and we have to make sure that we give them the care they need, when they need it, how they need it, and that we provide for them everything that they need. But there's an additional element here. We actually have to take care of families too. The family is the wind beneath the wing of the veteran. The family is the stability platform of our veterans, and they have to be integrally involved in the care of veterans. So I have to include veterans and family in the care model. There's really a third leg to that three-legged stool, and that's also our staff. Our staff are a wonderful collection of professionals. That includes not only the nurses and physicians, but also the ancillary allied health professionals, the EMS service members, the nutritional service members, all of the people, and by the way, that's not all of them, but all of the people that it takes in order to give our veterans the care that they need, they have to also be affirmed in everything that they do. So those are the three elements that I think are involved in patient and family-centered care. And that's what we're going to do. That's what we're about at the VA Maryland healthcare system.
Dr. Robinson, I know you hit the ground running when you came to the VA, and in addition to what you're doing directly with patients and with employees, you're working with veteran service organizations to hear from veterans and connect with veterans. Tell us more about that initiative.
Well, that initiative is something that you and your office, Dave Edwards, and others here at the VA Maryland Healthcare System have already had in effect when I arrived. But what I learned is that our veteran service organizations are an integral part of those partnerships, those strategic partnerships that we must have, because they're the ones that inform us as to what our veterans need. They're also the ones that inform us how we can deliver care to our veterans in a more substantial and in a better way. They are that sounding, they're the canary in the mine, as it were, because they can actually be the sounding board and also the alarm system that we need to use to make sure that our veterans are receiving the care that they need, and they're receiving it how they need it.
And I know the veteran service organizations appreciate being included in that care.
And they will continue to be included in that care. And as we travel into the My VA concept that people are trying to initiate. Now, the My VA concept is a quote new concept, but actually I contend that the My VA concept is something that the VA Maryland healthcare system has been doing for several years. And that means that we have to take the veterans' experience, we need to take the staff experience, we need to take strategic partnership, we need to take support services, and we need to take performance improvement. Those are the 5 elements of the My VA program. Those 5 elements, which have been recently introduced at the national level by VA, have been in effect here at the VA Maryland healthcare system for several years. I think that we need to reinvigorate parts of it, but I'm very proud to say that we have been doing those, and we continue to do that My VA concept, because we need to make sure that our veterans are first, but we also take care of all of the other aspects and our community relationships, our strategic partnerships, our staff, and performance improvement, as well as support services, to make sure that we can give the veterans what they need.
Thank you, Dr. Robinson. Dr. Marshall, I'll turn my attention to you now. For those veterans who want to stay with the VA Maryland healthcare system for urgent care needs, what's available for them?
Right, well, we actually have several mechanisms by which they can seek urgent care. So first, they can call our telephone care line. We have nurses who staff the line 24/7, 365 days a year. They can get medical advice, and they can actually get attention so that the nurse can help direct them to that area that can provide care for them if they need to be seen. We also have an emergency room here at the Baltimore VA Medical Center that's open every day of the year and staffed by physicians who are here to provide emergent and urgent care. The Perry Point location has an urgent care clinic for those problems that veterans need to be seen that day. They can come in between 7:30 and 4:30 weekdays and be seen by one of our physicians at that location. We also have walk-in clinics for mental health issues. So if you have a mental health concern and you think you need to be seen that day, we have a clinic here at Baltimore and at Perry Point for that option. We also have, for our returning veterans from Iraq and Afghanistan, a multidisciplinary group of case managers that can meet with them and help them navigate our system or get issues addressed that need to be done so in an urgent fashion.
So again, we're just meeting the veterans' needs when they need it.
When they need it.
What they need when they need it.
Yeah.
And we know that preventative medicine and primary care is important, but many of the veterans come to the VA Maryland healthcare system for specialty care. So what are you doing to meet the demand for specialty care?
Well, first, as you mentioned, primary care is very important. So that's the medical home for our veterans. We'd like them to be assigned to a primary care team, to have a primary care provider who gets to know them well, that has a case manager that works with them to address all those needs that the veterans have. And when the primary care provider recognizes that they have a specialty care need and they need to go, then we have a large array of different specialty services here at Baltimore and other locations that we can provide for them. Recognizing that we had certain specialty care needs that weren't being met previously, we have gone to hire additional specialists this last year into our programs to provide those needs. We have a special cardiologist that is an electrophysiologist. He deals with the electrical part of the heart, and so we've brought him on board. We have a new chief of our kidney or renal clinic who's here. We've hired 2 neurologists here and at Perry Point to help take care of patients who may have suffered a stroke or have Parkinson's disease. We have new surgeons have come on board. We have orthopedic surgeon. We have a new chief of our urology service. We brought some advanced practice nurse practitioners on board. So we have a large number of people who we've brought on board to address the needs of our veterans so they can get in and be seen in a timely manner and get the care that they need.
That's an impressive list of services. So what about, I've heard Dr. Robinson mention the safe, compassionate, and quality care for our veterans. We know that that's just as important as access to care.
Right.
What programs do you have in place to ensure that veterans receive that type of care?
Well, as I mentioned, the medical home model is really important. So for our veterans who come in and are assigned to a primary care team, we call them the PAC team. That PAC team is responsible for coordinating care. So you have one provider who knows you best, who knows what your issues are, who you can contact. You can secure message them through our email service. You can contact your team. You have your follow-up visits with him. And then as you go through the system, we have empowered all of our staff to be safety officers. So we have a process of stop the line if we have any issues, if patients have concerns, if a staff member needs to advocate for a patient for something they need, they have that ability. They are empowered to do that, to bring forth those issues for our veterans, to see that they get addressed in the appropriate manner. We also have a quality review of our care. We look for evidence-based research on which we base the care that we provide. We have top-notch and nationally renowned experts in many fields who review the care and the processes that we have and we provide. So I think there are many ways in which we ensure that our veterans get really safe, high-quality, state-of-the-art care.
Great, that's good for our veterans to know. And another thing that our veterans should know is that the VA Maryland healthcare system is also known for its specialized research and clinical services or centers. Tell us more about those programs.
Right, we do have quite a few research opportunities here, and we have 3 large centers of excellence. So we have a multiple sclerosis or MS center of excellence and an epilepsy center of excellence here in neurology. So we have people who are nationally renowned for their expertise in research and clinical care of veterans who have those types of medical problems. We also have an exercise and robotics program that's looking at using robotics to address some of the musculoskeletal and neurologic conditions that people have after stroke, such as foot drop. We have 2 clinical education and research programs, one in geriatrics and the other one in mental health. Our mental health group is looking at the seriously mental ill and providing care for those groups. So we have people that are leaders in their field who are on the cutting edge of new information that's coming out and can then translate that into the bedside care that our veterans receive.
This has been great having the 2 of you with us to share this information about the healthcare system. Dr. Robinson, you're going to join us later on the show, but we're going to take a short break, and when we return, we'll learn about what's being offered to veterans through the Veterans Benefits Administration. So please stay tuned.
The telephone care line is available 24 hours a day, 7 days a week.
If you've got a question about medication, diabetes, your diagnosis, any concerns, you can always give us a call. People want to hear a live voice and not the machine. We're always there to answer your questions. Give us a call.
800-865-2441 and press 1 to speak to a nurse. 24 hours a day, 7 days a week. A nurse is happy to help you.
Welcome back to Veterans Health Watch. Joining us is Mr. Antoine Waller, Director of the Baltimore VA Regional Office, and Ms. Amy Hill, Veteran Service Center Manager. Thank you both for joining us.
Yeah, thank you.
Mr. Waller, please give us a quick rundown of the business lines and services available for veterans.
Okay, certainly. Here at the Baltimore Regional Office, we are responsible for the delivery of non-medical benefits. Under the Veterans Benefit Administration, there are 7 major business lines. Here at the Baltimore Regional Office, we are responsible for 2 primary benefits, and that'll be our disability compensation and our vocational rehabilitation employment. Those are our 2 primary focus benefits that we deliver for the state of Maryland and across the nation.
And let's start by talking about the eligibility for disability compensation. I know that that's determined by the level of disability for a veteran. How is that level of disability determined?
Okay, I think what you have to look at, Kenya, is that there's basically two parts to the process. One is the eligibility. So if a veteran has suffered an injury or incurred any type of disease, or their injury has been worsened by their active duty and they have served honorably while on active duty, then they would be entitled to the benefit of compensation. Amy Hill is our Veteran Service Center manager here, and she can explain how the veteran would go forward with processing an initial claim for those benefits.
Amy, could you explain that for us?
Sure. So when a veteran has a disease or disability that was incurred in or aggravated by military service, our next step is to see how much social and vocational impairment that disability causes. So as we want no veteran to have served our country and then be limited in their life choices after the military. So our rating specialists have a schedule, it's called the rating schedule, and they determine the level of disability by how small the social and the vocational choices are limited to for the veteran.
And I understand there's a term, service connection,
Right.
that is associated when you're talking about an injury someone incurred
Right.
while in the military. Can you explain that term for us?
So service connections means that it is directly related to their honorable service. The injury incurred in or was aggravated. We are making a legal decision, so we presume the veteran is sound because they are serving the government, they are serving the military when they are brought in. Even if they had an injury before they came in, they're considered sound. Now we're looking at how much that disability was aggravated or whether a new disability occurred, and then the social and vocational impairment.
Okay. Mr. Wall, I understand you've made lots of improvements when it comes to processing these claims. Can you tell us about some of your accomplishments?
Well, at the Baltimore Regional Office, as an agency, we have about 160 dedicated employees that come in every day and give it everything to serve the veteran. Some of the things that we've accomplished is reducing our backlog of claims, and when I say backlog, that any claim where a veteran has been waiting for a decision more than 125 days, that's considered to be a backlog claim. So back in 2013, we had well over 16,000 claims. Now we have just under about 500. So we've seen about a 97% reduction in our claims backlog. And our inventory, our total number of claims waiting for a decision, has decreased significantly as well. We've seen about an 87% reduction. We started out with probably about a little over 20,000. Now we're down to about 2,800 claims this year, so we're doing really well.
Yeah, more than really well. That's impressive work. How did you reach those milestones?
Well, as an agency, we've transformed. 4 years ago, we handled a lot of the work to make a decision in paper. We're now a paperless environment, so we've become more efficient. We're using systems now that allows us to communicate much better. We used to use old antiquated systems. One system didn't talk to another, so now we have one single system that our employees are able to use to process claims and make decisions.
Again, the focus on the veterans. And Amy, I understand you're a champion of the VA's fully developed claim program. Can you explain the fully developed claim process to us?
The fully developed claim process allows the veteran to help us get all the information we need to make that legal decision. So if the veteran is seeing a private physician or a care provider for something, if they get that evidence and submit it to us, there's a new form in the VA called a Disability Benefits Questionnaire, and that lets their private physician or their VA physician, the VA also helps with this, complete all the questions and the answers we need to rate the case. Because remember, we're looking at social and vocational impairment. So we're not treating the person, we're determining their disability level. Okay. So what happens in a fully developed claim, the veteran gets all that together for us. Only thing that we have to retrieve is anything from the federal government. And that makes the processing time much shorter. We try to get that done within 90 days.
And this can be done online. The veteran can initiate this process online, right?
Right.
And through the e-benefits program.
So e-benefits, our service members now are enrolling before they leave the military, or if you're in Healthy Vet here with the VHA, you can get to e-benefits through that. And that is, authenticating that you are the person, and you can upload paper documents to us. You can file your claim online. You can submit all your evidence. So we have it, and it's in our system. And you don't have to worry about it being misplaced or put it in another veteran's file. You use e-benefits, and then you can track your claim, and you can see how we're moving with the claim and how far we are in the processing of that.
Mr. Waller, Ms. Hill, thank you so much for providing this information for our veterans. But before we go to a break, is there specific advice you would give to a veteran who maybe feels overwhelmed or has trouble accessing the Veterans Benefit Services?
Well, I would like to tell the veterans that they need to know that we're here for them, that we care about their needs. We're here to serve them. So one of the things that they can do certainly is to come visit with us in our office. We have skilled counselors that are waiting to address their needs. They can also use our telephone call center number at 1-800-827-1000 if they have any questions. And I would also encourage them to meet one of our many veteran service organizations as well to assist in getting the answers to their questions. We're here to partner with our stakeholders as well. So these are great opportunities to serve the veteran.
Right. Amy, anything you want to add?
I think a thing I can add is more than 50% of our employees are veterans, and probably more than 70% of them are family members of veterans. So we do care, and we are there to help. Our office is open 8 to 4:30 every day at the Fallon Federal Building in downtown Baltimore. So please stop by. We do want to help.
Thank you again for joining us. This has been very helpful for our viewing audience. And Mr. Waller, you're going to join us for another segment with Dr. Robinson to talk about how the VA Maryland healthcare system and the Baltimore VA Regional Office are working together to help our veterans. So please stay tuned.
Volunteering is an opportunity to show your patriotism.
Most importantly, it's a good feeling knowing that you're helping those who have already served.
And it's always an honor and a privilege for me to be there because I know that I get to help the men and the women who have served us.
So if you're interested in volunteering with us, best thing is to get in contact with us through our webpage, or you can also call us.
It really, really gives me an opportunity to give back, make a difference.
Welcome back to Veterans Health Watch. Joining us is Dr. Adam Robinson, the Director of the VA Maryland Healthcare System, and Mr. Antoine Waller, the Director of the Baltimore VA Regional Office. Thank you both for rejoining us.
Thank you very much again.
I understand you work closely together from the VA Maryland Healthcare System and the Veterans Benefits Office to bring together those services for veterans, to enhance the services for them. Tell us about the collaboration.
Well, first of all, it's been a pleasure to work with Antoine and VBA over the last 2 years. So as I arrived in the VA Maryland healthcare system, I had to first understand what VBA was, and that it wasn't the same thing as VHA, the Veterans Health Agency. It's the Veterans Benefits Agency. The second thing is Antoine came on as the director, and we got together, and one of the first things he asked to do is if we can do our town halls and a lot of our events, if we can do them together. Because we wanted to look at our veterans in the Baltimore area and say this was not about the health agency and the benefits agency as separate. We wanted to bring them together, and we wanted to allow veterans to know that if they have an issue with if they have a veteran issue with the agency in any way, we can partner together and make that happen. So it's been a pleasure to partner with Antoine, and he's been a wonderful person who has helped me understand what VBA is about. And he's a long-term VBA and VA employee, much longer than I. So it's been wonderful to have him as a partner.
Thank you for those accolades there, Dr. Robinson. I would also add that it was important that we have this relationship, and our commitment, and Dr. Robinson and our commitment, is to keep the veteran in our forefront, make everything about the veteran, that we are serving the veteran first. And we do that together. Veterans have many needs to address, and I believe that working together gives us a greater opportunity to stay very focused commitment on serving and delivering on promises.
And it's perfect for the veterans because they see it as one VA. They don't see the separate agencies. So that you two bringing the agencies together or the different administrations together makes sense for the veteran.
Well, I think it not only makes sense, but for example, at our town hall meetings, we have VHA, and that means all of my physicians and all the specialty in the primary care, a lot of the allied health, but we also have the VBA folks that are there. We have a lot of their experts that are there. We have the ability to actually reach out and help a veteran in real time during those particular events, or we can tell them exactly who they would contact, who they would call, who they would make contact with. So it becomes really an added benefit for our veterans to have us both there. By the way, we also have the NCA, the National Cemeteries Agency there. They also do a fantastic job, and they're usually there with us. They're not with us today, but they're also part of the VA, and those are the three parts of the VA that every veteran should know about and every veteran family should know about, because they provide care and integral care for veterans. So with VBA being with us at the town hall meetings, that has been a really an added plus.
And speaking of the town halls, we include the information fair where veterans can speak to someone one-on-one and take their time. And I know the Veterans Benefits folks are really busy at those events. Tell us more about how your people help our veterans at those events.
Absolutely. One of the things that we pride ourselves in is working together, and we leverage our organizations together, because when a veteran does come in to meet with us, he does only see, or she sees only one agency, and we need to make sure that when they leave our facility, that all their needs have been addressed. So what we do at these fairs, we provide assistance with our VA representatives. They're skilled and trained and knowledgeable. They can address those issues that are important for their veterans on a very personal level. And it leaves the veterans very satisfied and comfortable with getting information firsthand.
And before we close out the show, I know that both of you've mentioned putting the veteran in the forefront and hearing from the veteran. What have you done to make sure the veteran is included in your improvement processes?
Well, one of the things that we do together, again, we do have quarterly town hall meetings together, so we're able to present ourselves, listen first, and making sure that we're addressing the veterans' needs. But we're also getting out in our communities. We're working closely with our veteran service organizations to do a great job assisting VBA with the veterans' need, but also we're able to be in places where oftentimes our veterans aren't able to gather, but we're able to be there for them to address their needs, and that's been a great success for us.
Well, thank you both for being here. Thank you for all you do for our veterans. It's impressive to see how you're working together to better serve our veteran population, so thank you.
Thank you very much.
Thank you.
That's all the time we have for today's show. If you have questions about today's topic or would like to make suggestions for future topics, please call us at 1-800-949-1003, extension 5407, or you can visit our webpage at maryland.va.gov. You can also follow us on Facebook or Twitter. And if you are a veteran or you know a veteran who is not using VA services, please call us at 1-800-463-6295, extension 7324 for VA healthcare services, or 1-800-827-1000 for VA benefit services. We look forward to serving you. Please join us next time.
The telephone care line is available 24 hours a day, 7 days a week.
If you've got a question about medication, diabetes, your diagnosis, any concerns, you can always give us a call. People want to hear a live voice and not the machine. We're always there to answer your questions. Give us a call.
800-865-2441 and press 1 to speak to a nurse. 24 hours a day, 7 days a week. A nurse is happy to help you.